So what did you do at Odyssey?
It was amazing. So Paula Cook started it. She started doing auricular acu-detox in the orientation units at the beginning of COVID. Um, she and another psychiatry resident from the U. And the psychiatry resident quickly became too busy and wasn't able to continue it. And so I was doing my fellowship in addiction medicine up at the U. And Paula said, what would you be able to help me? Like we have all these people to treat. I can't do it by myself. And so for 8 months of my fellowship, I treated people first with Paula in the orientation units, and the response was so amazing that then I went to Lighthouse, to one of the adult houses downtown, and I did about 80 to 100 treatments twice a week for 8 months.
Now, these are people in residential care at Odyssey dealing with a number of substance use disorders.
Yep.
Okay.
Yeah. And at the time, well, I don't know if it's still like this now, but at the time it was the heart of COVID, right? So everybody was broken into cohorts, 8 to 10 people spaced throughout the house.
Right.
It was very stressful.
Sure.
And
In a situation that's already stressful enough.
It was just like, it was 10 people packed into a tiny little room all day together doing really difficult work,
Sure,
right? Like this
sure.
work is so hard for people. And a lot of irritability, a lot of anxiety, a lot of
What'd you
frustration.
say? No.
Yeah.
Yeah.
I mean, it was so intense. Like my compassion for those humans in that situation was, it was a lot. So I would come in on Tuesdays and Thursdays, and I would just go around to each cohort, put needles in. The way the protocol is supposed to be delivered is in a group. I would put everybody's needles in, and then they would listen to calming meditative type music, or actually do a guided meditation. And then I would take all the needles out, and it took me about 4 hours. So I would spend about 8 hours a week doing these treatments, and we collected data. So we had them fill out a survey before their treatment and after their treatment. And we looked at withdrawal symptoms, craving, irritability,
Triggers.
anxiety,
Yeah.
and sleep. Did we do? Oh my gosh, Randall, I'm so embarrassed now. I'm forgetting the 5 points. But we basically looked at how did it make them feel? How did they feel before versus how did they feel after? And everybody felt better for the most part. There were a few people that didn't like it, but the data that we sort of accumulated, we had 76 people who had done at least 2 treatments. So our N was 76. And now I remember what it was. So it was withdrawal, craving, irritability, anxiety, and motivation for treatment. So anxiety decreased, irritability decreased, withdrawal decreased, craving decreased, and motivation for treatment increased.
Right.
So we didn't actually collect data on retention because that was just too challenging.
Sure.
But anecdotally, there were so many patients that said to Paula and to myself and to everybody Adam Cohen, everybody that was working with them, this is one of the primary reasons I kept my butt in the seat and stayed, because I knew Amy was going to show up to do this for me.
We had a guest on last week, Stephen Moore.
Oh, yes.
Who credits that with why he stayed in the program. And a lot of other people that he stayed in the program with him, saying, because you can walk out of an Odyssey treatment program anytime you want, and the first 30 days are pretty significant, getting used to the rules and everything else. And a lot of people stayed in just because of that.
Yep. Yeah, it was probably the most, I sort of get emotional still when I talk about it, especially when I talk about Stephen. It was probably the most meaningful thing I've done in my professional career yet.
Really?
Mm-hmm. Yeah. It was really, really meaningful.
You're tearing up.
It was amazing. I mean, when I testified for the Senate, for our hearing for our bill a couple of weeks ago, I really thought very hard about what I wanted to say because I only had 1 to 2 minutes to say it. Yeah. And, you know, as physicians, especially I think people who treat behavioral health and substance use, it can be really challenging sometimes to feel like we're doing anything.
Because you see a lot of failure.
There's a lot of failure. And when you're sitting across the table from someone who's hurting in this way, sometimes there's just nothing to do. You know, like there's nothing to do but say, I'm sorry, and I empathize with what you're going through. How can I help you? Mm-hmm. You know, and that doesn't always feel like enough. Like it just doesn't, right? If I sit down with a patient who is really activated, whether they're sad, whether they're irritable, whether they're panicking, whether they're hopeless or helpless, if I say, can I put some acupuncture needles in? How do you feel about that? You know? And most of the time people are so desperate, they say yes, you know? And after they sit for 30 minutes, really without exception, I mean, there are exceptions to every rule, but really without exception, people feel better right there in the moment. And to be able to relieve suffering like that,
instantly,
right then, and to see that response and to experience that therapeutic connection that I'm able to make with someone like that in the moment is, I've never experienced it as a provider. And I've been practicing medicine in one form or another since I was a med student, right? So for 20 or more years. And so that's what I said at my Senate testimony. I was like, listen, this is a tool in my toolbox that I've never had before. And it works instantly in the moment to relieve suffering. And I don't know what else to say.